Hi everyone, I am Dr. Neha Gupta. I am a senior consultant, obstetrician and gynecologist practicing in Gurugram. So in this short video today, I am going to talk about hysterosalpingogram or the HSG. So, the couples who have been trying to conceive, they have been trying to get pregnant and they have not been able to achieve a pregnancy. They seek medical assistance, they go to a gynecologist or an infertility specialist, and many a times they will be advised to do a HSG. So what is basically HSG? HSG is a test which we do to check the patency of the fallopian tubes. We do this test to check that your tubes are open. Why do we need to check that? So I'm just going to give you a short explanation over here. For a pregnancy to happen, three things are required. First, the ovaries should be producing egg. Now this egg that the ovary releases is picked up by the fallopian tube. The sperm travels up from the vagina, goes into the uterine cavity and travels all the way into the fallopian tube. It is in this tube that the egg and the sperm will undergo a fertilization. They will meet in the fallopian tube, and then this fertilized egg will travel from the fallopian tube towards the uterine cavity or the womb as we commonly called it, and then it gets implanted here in the uterus. So that is the importance of fallopian tubes. If you have tubes that are not working, if you have tubes that are blocked, obviously you cannot achieve a pregnancy naturally, because then the fertilization cannot happen. That is why it is so very important to check that the tubes are open if you have not been able to achieve a pregnancy naturally. So what exactly do we do in this test? HSG is generally done immediately after your periods are over. So if your bleeding lasts for say 5 days or 6 days, then on the 7th, 8th or 9th day of your cycle, you will be planned to undergo an HSG test. Another precaution that you need to take when you are undergoing this test is that you shouldn't have intercourse in that cycle until you have had the HSG. Now, why do we take these precautions is that we want to be very sure that we are not disturbing an already existing pregnancy. So to ensure that, we tell the couples not to have intercourse until the HSG test has been done in that cycle, and we schedule the test to be done immediately post periods. Those two things you have to keep in your mind. The test is usually conducted in an ultrasound or in a radiology center. So you will be asked to go to the radiology center, and generally you will be given some medication some injection to relieve your pain and to relieve the spasm before you undergo the test. So about 20-30 minutes prior to the test, you will be given those injections so that you can remain relaxed during the test. Then you will be made to lie down after passing urine on an examination table. The test is actually conducted combined by a gynecologist and a radiologist. So the gynecologist will, once you are in the position and ready to do the test, the gynecologist will fix a metal catheter or a tube right in your cervix. Cervix is the mouth of the uterus. So at the cervix, a plastic or a metal catheter will be fixed, and then through this catheter we push a dye. Now when the dye is pushed, an X-ray film is taken by the radiologist, and in real time we see the movement of the dye through the cavity and out from the fallopian tubes, both the tubes. So when we take 2-3 serial films, we are able to see what is the shape of the uterine cavity, whether the cavity is normal or not. Also, if we see the free movement of the dye throughout the fallopian tubes and out of the tube, we are able to say that the tubes are open. So that is what the test is. The test will involve some amount of discomfort. It is a little painful procedure for women to undergo. But if you have a very low pain threshold, or if you are very apprehensive about the test, then you can let your gynecologist know about it. The test can also be done under sedation, that is, we can take the help of our anesthetist colleagues, and they can give you some medication which would put you to sleep, and that way you will not experience the pain during the procedure. And after the procedure is done, you will generally be prescribed a painkiller to be taken for a day or two, and you will be given a short course of antibiotic so that there is no chance of any infection. Once you get the results, you get back to your gynecologist to discuss the findings. So that is what the HSG test is all about. It can either show the result as patent fallopian tubes, open tubes. It can show that one tube is open, the other is blocked. It can also let us know what is the level of blockage, whether the tube is blocked at this end, right where it is attached to the uterus, or whether it is blocked at the fimbrial end or the outer end, the end which picks up the egg. Depending upon the level of blockage of the fallopian tube, further management can be planned. There are surgical options available to open up these blocked fallopian tubes, and once we have the results, everything can be discussed with the gynecologist. So I hope you found this video and the information about HSG useful. If you have any questions or queries, please do write into us, and we'll be happy to answer all of them for you. Thank you so much. Stay safe, stay healthy.